This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hey, are y'all able to see that? Okay, sounds good.
Yes.
All right, so we're PM&R. We're at the Sunrise GME. It's located in Las Vegas, Nevada. We're associated with a couple different hospitals. So we are part of the HCA system. HCA also has a negative connotation, but the benefits of HCA is it's a very large hospital system, so we can pull data from pretty much any part of the country or multiple hospital systems, leading to some very high quality research. We also have a lot of resources and a lot of funding for the residents. We get free food. Every single one of our didactics, we get free money for food in the hospital. We don't really pay for anything. They also have a lot of funding to go to different conferences, different experiences, and everything like that. So we also work with the VA here in Las Vegas. So our main site is MountainView Hospital. We have a 54-bed rehab unit. We also have our outpatient PM&R clinic. Then we also work at the VA here with a comprehensive outpatient PM&R clinic. It's very associated with the pain department also. We also work at Sunrise, which has 42 rehab beds. And then we also have a pediatric unit that consists of 4 beds. So these are just some institutional goals that HCA and the VA want us to talk about. It's basically going to make you a good resident, treat patients correctly, all that good stuff. So we do have an affiliation with a local university here, UNLV, and we also have an agreement with the DO Medical School here at Toro, which we go and actually perform. We go into their cadaver lab 2 or 3 times a year that we're actually planning that's coming up soon to look at all the different anatomy, and we work with the medical students closely from each of these schools. So what's unique about us, we're the only PM&R program in Nevada. We have a very wide differential of places that we work. We work at some, work a lot of inpatient private practice with private practice groups. We also work at a lot of outpatient, whether that be at the VA clinic, whether that be hospital-owned clinics, or also even private clinics. We have a state-of-the-art gate lab simulation center. We have 6 ultrasounds also in our clinic. We have an ultrasound machine in every single room. Remember when I did my intern year, we had like 2 or 3 ultrasounds in the entire hospital. Our clinic by itself, just in the PM&R clinic, is double that. So we have ultrasounds available in the PM&R clinic, the VA clinic, and also in all the hospital sites we work at. So we also have, we're affiliated, the VA just started a pain management fellowship. They just graduated their first class right now, and the second class has just started in July. I think we're developing a sports medicine fellowship that's associated with our residency here in Las Vegas, and still working on getting that set up. So we have a couple different core faculty. Dr. Dottie, she's trained in Ohio, and she is in charge of the MountainView Inpatient Rehab Unit. Dr. Poole is in charge of the Sunrise Inpatient Unit. And Dr. Lee is our program director, and he works in our outpatient PM&R clinic. He's very well known in the field of PM&R. He literally writes the books, and if you go to a conference, every single person there does it. Then Dr. Jung is our site director for the VA here in Las Vegas. So these are our current residents. We currently take 6 residents per year. Out of my class, we had one resident leave for medical reasons, and we were able to pick up another PGY3. So we have 7 people in the class below me. Then in Heather's class, we have 6 people, and a fairly large PM&R program as far as size goes. As far as rotation schedule, your second year is pretty similar to other programs. We get a lot of exposure to inpatient rehab. We do most of your time during your second year. We also give you 2 months in the outpatient PM&R clinic, split between the VA and the MountainView clinic. We get you a lot of good hands-on exposure, treating back pain, all the outpatient musculoskeletal and the rehab problems. All our patients from inpatient rehab follow up with us in the clinic. We have a continuity clinic associated with us. PGY3 start going more into the outpatient side. We do 2 months of EMG. We also have dedicated time in pain management, along with pediatrics, elective time in sports. We don't have a dedicated spinal cord unit here in Las Vegas, so we actually go to San Diego for 2 weeks. That's completely paid for by the program. They put you up at a very nice hotel in La Jolla. You get a very healthy meal stipend every single day. And it's a nice little break to get out of town and spend a rotation in a very nice area of the country. And then you also get a lot of inpatient pain consults during your 3rd year, get exposure with kind of high dose opioid pain management. Then in your 4th year, a lot of the rotations are similar. We still do the pain consults. We have the inpatient senior where you're in a supervisory role over the 2nd year students. You also continue to make sure that you get your EMG numbers and you have more time in the clinic, almost 3 to 4 months. As far as vacation goes, we're on the higher end for most residencies. We have 20 vacation days. We also have, on top of that, we also have 5 dedicated academic days for you to go to conferences, take step 3, go to various things, interviews for fellowship, or if things come up that are more academically oriented. So as far as didactics, every Wednesday from 1 to 5, we go through, it's on a 12-month schedule. So we go through the whole curriculum every 3 months. We start, and we also, the program does provide us with a PM&R Q bank. They provide you with a Cooperillo book. And 2 to 3 times a year, which I believe is, we shine at, is we go to the cadaver lab at the Toro University 3 to 4 times a year, working with our attendings, looking at all the anatomy and really getting some hands-on learning. We also participate in journal clubs, mainly when you're a PGY2, you'll do a journal club every few months, talking about a problem with a patient in the inpatient rehab unit. And then when you move into the PGY3 and PGY4 years, we have a grand rounds. We also do board review lectures. We also like to do a lot of hands-on workshop, whether that be Botox injections for spasticity. We get the reps from the Botox companies to come assist us with that. And we also do a lot of ultrasound workshop to make sure that we're proficient in that. So this is really talking about educational goals, journal club, didactics, academics. We have to do a QI project. Dr. Lee is very big into research. If you come here, you'll get put on a research project with him. We have a lot of resources through HCA to get those things done. And he's very well known and very good at research. And we get a lot of time off. We don't work nights or weekends. So he definitely emphasizes doing research and studying on your time off, trying to be the best resident you can be. So we get a generous stipend for board review. We get memberships in AAP, PM&R, and AAP. If you do research, they pay for you to go to any conference that you want. They also pay for a conference out of pocket, even if you aren't presenting anything one time during your residency. We also have a very healthy stipend for educational materials, whether it be books, question banks, board review prep, PM&R recap, things like that. So just talking about progress, we take the SAE once a year. We do a quality improvement project. We do mock oral boards once a year in June, just to make sure that we're on progress to pass everything. And as far as resident well-being, I'm actually in charge of the resident well-being committee. I think the biggest thing about well-being, we can talk about this, we get free food at the hospital, but we get a lot of time off. We don't work nights or we don't work weekends. We don't take call, we don't take home call. When you go home from work, you're off. So you won't work a Saturday, you won't work a Sunday. It really gives us time to, be able to enjoy our lives. Whether you have a family, I have a dog, and I like to take him to the dog park. It also gives you time to, study effectively when you're not at the end of the day, when you're, burnt out, or, you've been working in clinic all day and you're tired. You have all weekend to work on research projects, to study, to try to be better for Monday, and be able to learn these things. We also have a lot of wellness committee activities. We get together and have sports. This weekend, we're having a welcome party for our new residents. We're going over to our residence house and we're having a barbecue. We also do official dinners with faculty. One year we were able to get HCA to pay for a free ski trip. HCA, we'll see if they want to pay for that again in the future. But we like to get together a lot. We're a very close residency. A lot of us have families, and we also and like to enjoy our life outside of work. Some of the previous year's events, we've done the wine and paint events. We have a Friendsgiving every year. This picture on the right is from when we took a ski trip up to Utah. That was Brian had. So these are all We also have a welcome dinner with the faculty. We usually have two. We have an unofficial one with just the residents to get to know everybody. Then we also have a welcome dinner with the faculty. We had a Memorial Day cookout this past year. We forgot to take pictures, so sorry about that. We also get the program to pay for more educational type activities. We went to the body exhibit to look at all the anatomy, and then we got to then pay for all you can eat sushi after that. And we also get a lot of recruitment dinners from various companies like US Physiatry. And they take us out to dinner. They teach us more about recruitment, finding a job, contract negotiations, and it's a good way for us to get a free steak dinner, and it also can help you negotiate and get a job in the future. We also have a Super Bowl party. We had a Super Bowl party over at my house. We brought all the dogs over. We had a pretty good time. And then graduation. We just graduated our 6 residents. I believe one of them went to a pain fellowship. 3 or 4 of them are doing a inpatient rehab job, whether in California or Las Vegas. And one of them is moving to North Carolina. I believe they're doing telehealth occupational medicine for right now. And they're still toying around with the idea of doing an amputee fellowship. So upcoming plans, we're going to have the welcome dinner for the residents coming up. I think Labor Day. We're going to try to go to Lake Mead and go out on the boat. We're going to have a Friendsgiving, a Christmas party, hoping to have a Super Bowl party. And I want to have more educational wellness events in the spring and the fall, finding a good exhibit here in Las Vegas. We also do graduations, more informal events with everybody. So if you didn't hear me say it enough, we don't work nights, we don't work weekends, we don't take call. I feel like that was one of the biggest draws of me to this program. I have a dog, and I really like to enjoy my life outside. I like to work hard when I'm working, and also like to enjoy the time. And I believe if you're looking for that, this is the best program to come to, because we really do emphasize making you the best doctor that you can be. We also understand that life is not 100% work. You have to enjoy your life. You have to be able to rest so you can perform well, in the coming week. As far as Las Vegas, nobody's been here. It's Las Vegas. There's the Strip. You can find pretty much anything you want to do around here. There's tons of music festivals. There's good shows. There's sports. There's events. There's restaurants. There's the Strip. There's everything you can possibly imagine. And going along with that, people that are more active, we have Lake Mead right next to us. I've been out on the boat a couple different times. I'm originally from Mississippi, and I grew up on boats. So it was nice for me to get out there and get back around the water. We also have the Raiders here. We also have the Golden Knights, who recently won the Stanley Cup. And then 1 hour away is Mount Tarleton. So you can actually go to a Raiders game in the morning, and you can actually drive up to Mount Tarleton and go skiing in that afternoon. A lot of the residents, we live out in Summerlin. It's a suburb of Las Vegas. It's where most of our main hospital is located at. It's right outside of the Red Rock National Park. It's pretty affordable. There's a ton of golf. I like to play a lot of golf. I'm not good at it, but you can play a different golf course every weekend for the next 3 years while you're in residency. There's lots of shopping. There's a minor league baseball team, and there's also a minor league hockey team. So with that, I'm going to stop sharing my screen, and if anybody has any questions, we are available to answer them. Oh, we had a question about the first off with the IMGs. Yeah, we have a fair amount of IMGs. Our program director is originally from South Korea. We have a history of about, I want to say maybe a third to a little bit more than that have been IMGs or coming from different parts of the country. So we're very open to that. We don't officially have a step 2 cutoff. We take a holistic application, dedication to PM&R, research, board exam scores. It's really a holistic approach. Dr. Lee really just wants to see your commitment to the specialty. He's very passionate about PM&R, and he really takes a holistic approach, trying to find the best people to bring in. As far as the patient population, we get a very wide breadth. We work in some private practice clinics. We have patients that are cash pay. We have some minor league and college athletes that we work with through our sports medicine clinics. We work with one of our outpatient PM&R doctors. He does a lot of exposure to sports. He actually works as a ringside physician for boxing, jiu-jitsu, MMA. So there's tons of exposure to sports and ringside physician if you want. We also work a lot with the veterans. We spend a lot of time at the VA, so we get that patient population. And we also work at multiple different hospitals, Sunrise and MountainView. So we get patients that are from poor socioeconomic backgrounds. Las Vegas is kind of a melting pot from a lot of different patients, whether it be white. We have a large Filipino population here. Really any race and really background that you can imagine, we get exposure to. Okay. And then I will share our contact information. If you have any other questions, you can definitely let us know. And then if you're ever in town, you feel free to contact us. You can come by and see. I can give you a tour. Done that for some people that have been around in the past, and we just love to get to know you more. So I'm going to put my email in here. Heather, do you have anything you want to?
You kind of nailed it on the head, Jeffrey.
All right. So that is my email address. So as far as a dedicated research track, we don't specifically have like a research track taking time off. During your elective time, you can do a research rotation. Dr. Lee's, like I said, he's extremely well known. If you come to this program, he'll email you randomly and he'll send you a case report and you'll get on research. And there's definitely tons of opportunity. We have a full gate lab that we're trying to make more robust. We have research opportunities through the VA. You can do electives in research, and Dr. Lee would absolutely love that. But you'll definitely get research here, and there's plenty of it to go around. Yeah, if anybody comes into town, please let me know. Shoot me an email, and if I'm not available, I can find my co-chief, or I can find Heather, and somebody will be able to give you a tour. And we can always help facilitate that and answer any more questions. It's just a lot of information. You're hearing about a lot of different programs. So if something comes up, I'm sure you'll think, oh, I should have asked that. So definitely feel free to ask us. And did my email address come through?
No, it's not there.
To PM&R Scholars meeting group chat. How about that? All right. Did it go through now?
Yeah.
Okay. All right. I don't think if there's any other questions, I will turn it back over to our hosts. And that's like I said, feel free to reach out. I'm pretty laid back. So, and no, we don't have an official step 2 cutoff. Take holistic applications. Obviously, we'd like them to be high, but that's not the end all be. And we do have an affiliation with UNLV. We're going there in a few weeks to talk to the first year medical students just about PM&R, more of an interest group. We work a lot with the UNLV students. We get a lot of students that rotate there. As far as official rotations, and there, we don't do any official rotations with UNLV affiliated clinics, but we're associated with the medical school, absolutely. As far as intern year, we don't have an integrated intern year. Heather, you probably talked about this.
Yeah, there's 2 transitional year programs in Las Vegas. One's at Southern Hills. It takes 13 people. One's at Mountain View, which is good to get experience. It also, I think that takes 12 or 13 people. I did mine at Southern Hills. I feel like it was pretty well-rounded. It's a good program, yeah. Or there's an internal medicine prelim at UNLV too. Those are the kind of 3 options in Las Vegas.